God.
Hi, hon. Okay, do you have the cash, the pin pad so I can do an Apple Pay? Thank you.
So, yesterday morning, 8:04 a.m. Remember that time. Dani goes, because she's nauseated, to Starbucks. Had to go get Enzo's food. I think he's on special food. You can actually DoorDash that. You could have Amazoned it. As long as your doctor's written a prescription, you can get it from Chewy. It could be on auto delivery. Imagine that. Or, hey, I have a really novel idea, Dani. Have one of your real-life friends go pick up a bag. Wouldn't that be nifty? Oh, where are your work friends? Where are the softball girls? Where are the friends from the previous job? Where were the two girls that helped you when you had septus? Where is everybody? Where are your real life friends? Also, Starbucks is not something I or any other medical professional would ever recommend for nausea. Claims that last night almost went to the ER because the pain was excruciating. 10 out of 10 pain. And a few hours later, we're in the car getting Starbies for nausea. No, that is not what you do. Hopefully she's wearing her binder. Let's see, because this is half an hour of silence of Dani driving. Oh, and groaning, grunting, and sighing. Here we are driving. There's the binder. It's on not appropriately. I know you want to hear all the grunts, right? Oh. She's wheezing something awful. This is content. Here's the best way to watch Dani. Just do this, okay? Oh, oh, oh. There's our Starbies. Oh, at least she drank it almost all. Huh. Yum, yum. Got our hand on our Starbies. Hand on our Starbies. We're speeding down the road. Come on. It won't let me do it. Come on. Why?
And so I'm waiting for the nurse to call me back to give me instructions because I was very close to going to the ER last night. I was very close.
So dramatic.
Like, it's burning. It feels like... I can't even explain it. I just can't.
She can't explain it. That Starbies will help.
And I shouldn't be in this much pain. That's the problem. I just shouldn't be in this much fucking pain.
Ma'am, if you were in that much pain, you wouldn't be driving.
So I'm gonna wait to hear back from my nurse and then figure out what the hell she wants me to go do.
You are killing your transmission.
I mean, I don't want to be out right now. I really don't, unless I have to go see my doctor. But Enzo's out of food, so I have to go get his food because I have like nobody. Don't you do that, twat.
Says the woman who can't drive and gets in accidents.
So, you know, again, this is what it comes down to. Yeah, driving.
Where's your friends? Where's all your friends? Where's your friends? Why not stock up on food before surgery? Yeah, you went shopping for yourself. So, 8 I'm sorry. I was 5 minutes off. 8:09 a.m. So then we go up to 9:54 a.m. A mere hour later, what happened? What I want you to notice in this is, I hate this fucking thing. Stop it. What I want you to notice in this is how many ways she describes the same thing. She describes nausea 4 different ways. I threw up, I vomited 2 different ways. I was lethargic, exhausted, tired. Ma'am, stop describing things 700 ways to the wind to fill up time. You like to hear yourself talk. You're saying the same thing. Yet, we're going to claim we didn't even drink our Starbies when we see it in the thumbnail.
So you don't need to be seen. That's good. Yeah.
Grunt. Grunt.
Oh no, I already sent a picture into my chart.
Hold on. There we go. How does she feel? I had to go back to the beginning.
I'm not sure you my stomach, but
You do.
there's stuff coming out of the incision.
Because you pulled your
I think.
steri strips off and didn't clean it? Your hygiene is awful. It's a lot of grunting.
Oh no, I'm sending I already sent a picture into the doc and I have to wait. They don't want me doing anything until I hear back from me.
An hour ago we were driving, cussing at other drivers, getting Starbies. Watching a show. I gotta speed her up. I got her on 2x. Jesus. Why do people watch this shit?
No, like I died.
Oh my God, so much wasted time. All for Mimi and Gabby to feel guilty. They left baby Dani alone to fend for herself because she has no friends. Why didn't tell your...
I already sent a picture into my chart.
You already said that. What are you worried about, Dani?
So, I won't real know. No, I'm not running a fever yet.
Yet. She's preparing for a fever.
No, I'm just really tired. I just feel like, I just feel awful. And I feel like my body is just drained. Just mentally fucking drained.
Mental is the key word. An hour ago, you were upright driving, flooring it, beeping your horn, getting Starbies.
Yeah. So, I sent it to the nurse. So they're gonna call me back and then give me either probably send an antibiotic in. But they're like, it sounds like you could have an infection if the mesh is causing the infection, so I need to see a picture. And so, like, they're gonna dissect it with the picture, and then if they feel like it's necessary for me to have antibiotics, they're gonna send it in.
Can we dissect that statement? They're not dissecting a picture, Dani. Stop sounding like you know what you're talking about. They're gonna look at a picture. They're gonna look at... They're going to probably send you antibiotics prophylactically because you're unhygienic. They deal with patients like that all the time. They're also going to wonder why your steri strips are missing. And you'll have to be honest and say, well, I picked them off. You did this. You're still full of crap. You need to move.
Correct. So you don't need to be seen. That's good. Yeah.
Well, she wants to be. She wants to be in the hospital. She wants to milk
They
it.
told me just to stay put until they look at the picture. And then they'll go ahead and determine on what to do.
It'll be at the end of the day. You're not emergent. I hope you told him you live stream.
That's okay. I'll push this out.
Why turn on a live stream if you're going to just lay there like a blob? It's not impressing Mimi or Gabby.
We are here for you. I appreciate that. I really do.
If these people were your friends, they'd fly down and help you. That's what friends do.
No fever.
Oh.
No fever.
I can't take more. Preparing for surgery. Here it comes.
The mesh is what they're concerned about. The mesh could be the one that's infected. And if it's infected, that means that they're going to have to go back in and remove the mesh.
I'm not body shaming, but you do realize that that mesh is protected by a large layer of adipose. Infection is most likely, if there is even an infection, in your belly button where the incision is, on the steri strips that you peeled off, allowing the glue to dehes. She's not going back into surgery.
What are you feeling? I feel very nauseous in the pit of my stomach.
Here we go.
I feel very tired, very exhausted, fatigued. I feel burning sensation in my stomach. Like it feels like it's burning. I vomited, I threw up last night in the middle of the night. I felt very lightheaded and dizzy.
Why does she use multiple words to describe the same thing? Because she likes to hear herself.
Like I feel like I have an upset stomach.
You already
That's
said
what
that.
it feels like. And it hurts so bad. Yeah, I have. No, I sent a picture into my chart.
Oh, the groans get bigger.
I didn't even drink the Starbucks. It's sitting in my car right now. I couldn't even drink it.
We saw it. It was half drunk.
Is the incisions itself painful? Yeah. So I don't know what they're gonna do or how they're gonna do it. I won't know anything until they look at the picture on my chart.
And dissect
And
it.
then they're going to get back to me if they're going to, like, send a prescription in for antibiotics.
Which can be delivered. But Dani will drag herself out of bed like the trooper she is. Oh my God. Okay, first off, people, you can mentally make yourself hurt more. And that is what she's doing. Sitting and feeling sorry for yourself and not gathering your strength and getting out of bed and being an adult means you wallow in your self-pity and you create pain where there is none. It is a proven fact. But look, the next day she's sitting doing diamond art, fake depressed, listening to loud music. So let's just speed along here. Do. Why even go live? I don't want to be alone. Where's all your friends, Dani? People need real life friends. Oh, wait, let's go back a second. Okay, let's go back a second real quick. Oh, she's about to get up. I want to see her get up. Okay. Oh, we're doing our diamond art at 2x speed. Oh, Enzo needs me? Okay, real time. Oh, the pain. The pain. Oh, where did we go? Here she comes. She's coming back, folks. Oh, is everyone looking? Are you looking at me? Are you looking at me? Oh. Okay, I'll go back to ignoring you. Okay, here we go. Milo, you need to stop, sweetheart. I don't know why that gets him excited. Now look what you did, Milo. Oh, the music stopped. Let's hear if anything big comes out of her mouth. Oh, I'm shuffling to my bed. So slow. Oh. You know when she stares straight ahead, she's in her performance, blinking hard. Come on, let's have a hard swallow. Turn it up. Turn it up. Are you watching? She has a device. I'm turning it down. It's probably going to be awful music again. Even TikTok doesn't like you. Oh, now we're going to watch a movie with everyone present? Please feel sorry for me. This is ridiculous. 33 years old. Are you kidding me? 2 days before.
So.
"15th. 5 days after procedure. A procedure that can be done locally.
Woman. Jessica, I just got informed that Jessica is saying that I stole everything when I was at the stores getting everything
Oh,
that I
God.
needed.
Look at this. The 15th, 8:27 a.m. Cooking.
Good morning.
Doing dishes.
Was last night
Wow, totally forgot our excruciating
the
pain.
worst it's been? I think so. I don't know. I don't know, Jules. I don't know, Selena. It's just been... It's absolutely ridiculous. I have never met somebody so... I don't even know the word. I don't even know the term. I just don't even know.
Notice when why is her breaker box open? Why? Is that a breaker box? Looks like it. Yeah. Why is it open? Is she tripping breakers? Notice how when her mind is distracted by TikTok drama, she forgets the pain. No grunting, groaning, throwing up, lightheadedness. No, we're eating.
Reggie drew a circle around my stomach where they were doing it, and the bruising is going outside the stomach,
That's fine.
and it's going around, so...
That's what she's worried about. Oh, getting in bed. Eating. You should be walking. Walking. You just ate a whole shit ton of food. Man. You shouldn't be laying in bed vaping.
Helps the healing process from a nurse perspective. You're not going to heal.
Shouldn't like to hear that.
How stressed as it is.
Wow. Got some nice pupils there. You have people giving you good advice, but you want to play victim. Back to this. Yawning. Vaping.
Just need to moving around.
You should be.
It affect it when you're getting up and out of bed like all the fucking damn time. Yes, it can affect it. Yeah, it's okay.
Oh, I see. So getting out of bed is bad, per Dr. Dani. Vaping in bed and eating in bed is good.
Yeah, I could just talk in the chat.
Let's see it. Let's see this magical wound. Magical wound. We want to see it, ma'am. Come on. Here we go. Here's what we're worried about, okay? First off, your steri strips are missing. You fucked with it. You shouldn't have done that. Secondly, there's a thing called gravity and there's a thing called perfusion. But I don't think you got that far in high school biology, if you got there at all. The circle he drew is not a demarcation of infection. It was the area that the surgical drape is being cut to expose your skin. Okay? Blood has to seep out as it's dissipating. It travels. You're not solid inside. It travels through cells, through capillaries, and eventually fades away. And yes, it's going to go outside the circle he drew. Let me tell you, that surgeon is going to give you antibiotics because he doesn't want to hear you. Prophylactically, he is going to give them to you to prevent infection because he can already tell you're messing with it. It looks like it's healing just fine if you'd stop pulling the steri strips off. They will fall off on their own. And bruising never looks good. Who looks good in a bruise? But you're playing with it and freaking out about a magical ink pen. Unfortunately, you don't have training or an education to know what they mean. So I'm telling you, there's a lot of adipose an infection would have to get through to get to the mesh. If any infection develops, it would be on the surface, and that would be due to you being unhygienic. You want an infection. You want Mimi and Gabby and everyone to feel sorry for you. What it does is it tells people that you're not clean. So if that's what you want to convey to the world, go for it. This is a whole lot of nothing. It looks like it's healing just fine.